Okay, thank you. So we are at the last segment of our program today. Thank you all for sticking this out. I've had, as I said, this has been an incredible day. I'm inspired, I feel empowered, and I've learned a lot from all of you. So thank you so much for being here. This was our first, major patient day ever, so I hope we did an okay job. Thank you. And before I forget, none of this would really be possible, as we said, without the support of our sponsors. So Horizon, Genentech, UCB, thank you so much. And then Dr. Ben Greenberg at UT Southwestern and Paula for helping us. SRNA for being such a great partner and collaborator. And then I have to say thank you also to Spectrum Science, Brand Live, Encore. You guys killed it. Thank you, thank you, thank you. Jill Sharp, our Chief of Staff, thank you for all of your great work. Jasmine Patel, who just moderated a wonderful session. Kira Chaudhry back there. And then, of course, Avery and Liz, who are our ambassadors, and they've been our hype girls for the day. So we're going to go through this very quickly because I know everyone's super excited about happy hour. I am too, for sure. And this is about how do you get involved with the community. So I will quickly go through TSF, and then Rebecca here will go through SRNA. So let's fire up those slides. Okay, so the Sumaira Foundation, we have been in existence since 2014. We illuminate the darkness of NMOSD and MOGAD. Next slide. Oh, I can do it, right? We have 4 pillars, so that's awareness, community, advocacy, and research. Patients first, powered by positive community, empathy always, driven by science, and therapy agnostic. Ambassadors, oh, these are our ambassadors are our pride and joy, really. As I said earlier in the last panel, we have 50 global ambassadors, and we illuminate the darkness together around the world. Here they are. You could see a nice little collage of them, some statistics about where they're from. So 15 countries, 15 languages, 93% are women, 7 are caregivers, 2 are pediatric patients, 7 with African American heritage, 6 Asian, 3 Native American, 7 Latinx, rural communities, and of course members from the LGBTQ+ community. Voices of NMO. So this was our first program that we launched in 2014. It is our first and longest program. It's our story sharing platform. To date, we have 150 stories in our library from all over the world. We share perspectives from patients, caregivers, physicians, researchers. We've shared from infusion nurses. So I hope that anyone who goes to our website is able to read a story that they can relate to, because there's so many incredible stories. From the experts, it's our webinar series. We're about to have our 42nd webinar in 3 years. We now have webinars in French, Italian, Spanish, Dutch, German, soon to be Urdu, soon to be Hebrew. And I'm sure I'm missing some languages, but we try to be inclusive as much as possible so that we can meet people where they are. Demystifying NMO and MOG, this is our podcast. We're in season 3 right now. I love this because who doesn't love a good podcast? And it's run by a patient ambassador. Every episode, we're sure to feature a patient and a clinician together. So it's kind of like a nice intersection of 2 perspectives. Meet the author. We've started doing this series last year. So our first one was with Susanna Cahalan. She has autoimmune encephalitis. Her book sold 2 million copies. It's a New York Times bestseller, and then Netflix made a movie about her. Tyler Perry produced it, which is super cool, and then I became friends with her, which was incredible, and I interviewed her. Then we did Megan O'Rourke, and next week we are interviewing Kyle Bryant, who is the author of Shifting into High Gear. This was a book I actually read at Horizon. He has Friedreich's ataxia, but our goal with this program is to bring authors from other rare diseases to inspire our community. The Human Collective Project, this is our support group meeting. So this started during COVID. when, of course, everyone was homebound, and especially our immunocompromised community was very vulnerable to the disease, so they were even more isolated than usual. So we started these virtual support group meetings, and they are still going very strong. Every 3 months or so, we add a new country. So we have them in the US, UK, South Africa, Germany, France, the Netherlands, Canada, Denmark, and we have one for caregivers as well. Our pediatric support, patient support program with unicorns. So very short story, but our mascot is a unicorn, and this came out of a terrible story of a little girl who got sick with NMO in 2019, and she passed away. And so we launched a pediatric research grant for her called Joanni's Unicorn Grant. She loved unicorns, so now we have unicorns in honor of her. And anytime we're aware of pediatric patients anywhere in the world who has either NMOSD or MOGAD, we send them a pediatric care package with a little note from me and one of these adorable unicorns. We have a lot of different resources, so here are a few examples. Sorry, this is distorted, but we have compiled all the different support groups out there and pages into one document that's clickable, accessible, screen reader friendly. We work with the PAN Foundation and the Assistance Fund to help patients get access to therapies. Oh gosh, sorry, these are very distorted. Sorry about that. March was NMO Awareness Month. We just came off of an incredible March. We got 36 proclamations in the US to designate March as NMO Awareness Month. We had a lot of different illuminations around the world lit up for TSF, and we're doing the same in April for MOGAD Awareness Month. Happy MOGAD Awareness Month, which starts today. Research. We started funding research 4 years ago. These are all the different projects that we have funded. It's about $600,000 in research. I'm hoping that this year we break the $1 million mark. We just started funding international research a few months ago, so I'm hoping to see this list or this collage get bigger and more colorful over the years. We have our gala, April 22nd. If you know me, you know I like to throw a good party. So we are able to fund our research because of the funds that we raise through our gala. So on April 22nd in Boston, during the AAN conference, we are having our 6th annual gala, and I hope to see you there. And we are hoping to raise $375,000 for NMOSD and MOGAD research there. And that is all. That was quick. Thank you.
I think this is working.
Yes.
Oh, okay, wonderful. All right. Well, thank you again for taking the time to be here, and thank you, Sumaira and her team, for putting together an incredible agenda. So you've done a lot of work, so really appreciated, and thank you for having SRNA be a part of it. And to Dr. Greenberg and the UT Southwestern team, you guys are amazing, and really appreciate your support as well. So I am Rebecca Whitney, Associate Director with Siegel Rare Neuroimmune Association. And whoops, I did that wrong. So let's try to hit the right button here. The Siegel Rare Neuroimmune Association advocates for, supports, and educates individuals and their families diagnosed with acute disseminated encephalomyelitis, acute flaccid myelitis, MOG antibody disease, neuromyelitis optica spectrum disorder, optic neuritis, and transverse myelitis, and accelerates and invests in scientific research, therapy development, and training of clinician scientists dedicated to these disorders. Our end goal at SRNA is to improve the quality of life of individuals with rare neuroimmune disorders and redouble our commitment to finding a cure together. So we were founded in 1994. We're a team of 8. We're supporting 15,351 people from over 121 countries. Our membership, we had 573 new members join in 2022. These include individuals who've been diagnosed with AFM, ADEM, MOG, NMO, optic neuritis, and TM. And it is inclusive of their relatives and caregivers, healthcare professionals, and others who have an interest in these particular disorders. We've updated some of our membership forms and our membership packets to provide newly diagnosed individuals with the pertinent information about their particular diagnosis, as well as the programs and resources that SRNA can provide. So I'm going to skip through. I have a lot of slides, so I apologize. I'm going to skip through a few of them. But so, like I said, we are worldwide. Obviously, being in the States, most of our membership is in the States, but we continue to add global membership on a daily basis. And this is the team who supports SRNA on a daily basis. We're quite small, but I like to think of us as quite mighty. We do a lot as a small team. And even though we have our different responsibilities, we collaborate. We have to work together in order to support the families and individuals with these disorders. So, and these are our 3 pillars: connect, care, cure. For the connection, this is probably one that is of my heart the most, being a caregiver of a child who is diagnosed with transverse myelitis, but we connect with individuals in the community through our support group network and our peer-to-peer program. We provide personalized support via phone calls and emails. I always am really surprised to hear when I pick up my phone and say hello that someone says, "Oh, you actually answered the phone." We do answer our phones. We provide that personalized support. Even our info, our general email inbox is monitored, and we do reply to those emails as well. So in 2022, 50 support group meetings were held with over 375 attendees, and we have provided over 50 peer connect requests with connections and have 150 documented individual connections between individuals. So with our Peer Connect program, if someone is reaching out and they want to have that one-on-one support, not necessarily comfortable just yet with being a part of a support group, we can help facilitate that one-on-one connection. We connect with our community via our blogs, our SRNA magazine. And this one is very special and very close to my heart, our SRNA Quality of Life Family Camp. This is a unique opportunity for families with these rare disorders who have a child or a young person diagnosed with one of these disorders. We bring them together, we connect with one another, and we also connect them with the medical professionals who are experts in these disorders. So it's available to the families, their siblings included, because these disorders do impact the siblings as well as the caregivers and the individual themselves diagnosed. So last year we had 14 families attend our 15th year of camp, and this year I'm excited to announce that we are going to be coming to San Antonio, Texas, to Morgan's Wonderland Camp in July. So keep your eyes and ears peeled for the announcements online to be able to sign up for camp. So we also have our Hope Ambassadors. This was launched in 2017 with a 100-day My Life, My Hope campaign. And we've continued to feature these stories of individuals as we add new stories on, and we collaborate with partnerships with other organizations, such as Sumaira, to increase awareness and support. So we also have our This Is Me. This is another educational awareness opportunity that allows people to share their stories, to showcase who they are, not just their disorder, but to truly understand who they are and what this means to be living with these disorders. So we also offer different community supports via our walk, run, and rolls. These are usually organized by our community member volunteers, and it's really a way to provide education to the local communities about a family or individuals who may be there about these disorders. And we launched those in 2012, and we've held 35 walk, run, and rolls to date. As far as our care pillar, we do have our website that we established in 1997, and we have an extensive website. Sometimes we even talk about, oh, maybe this is getting a little too much, but we have everything on the rare neuroimmune disorders, from diagnosis to treatment to ongoing care. Have had over 458,000 users have accessed our website with over 9 million page views.
Wow.
So one of the major components of our website is our resource library. This is where we have housed everything that we have put together since 1994. I actually was browsing it the other day for past newsletters when they used to be over 100 pages. Bless you, Sandy. I don't know how you wrote all of those, but we have all of that there since the beginning, and it includes all of the different formats of information, whether it's podcasts, symposium video, magazines, and external resources as well. So we also have our myelitis helpline, and to date we've had 506 individuals supported through the myelitis helpline. And our rare neuroimmune disorder symposium. So that first one was held in 1999, and we had over 100 attendees from around the world. And since then we host it annually. And we alternate between an international and regional engagement. And we did have our hybrid event, thanks to COVID, in 2020. So it is a one-of-a-kind event that brings together, again, those individuals and their families who've been diagnosed with these disorders, as well as the clinicians and researchers that are experts in researching and caring for those individuals. So these are our objectives for our meetings: the biology and causes, managing the symptoms, and then what we're doing as far as research studies. We also have our disorder information sheets. So these are extensive fact sheets, packets that include, like I said, the very pertinent details of what these diagnoses may mean. In 2022, we do have all of our information sheets translated into Spanish and are expanding that. So our ABCs of NMOSD podcast, which is a collaborative effort with SRNA, Sumaira, as well as the Guthrie-Jackson Foundation. So the ABCs of NMOSD brings together the latest information and research about all things NMOSD, and we also have expanded that to include MOGAD, from diagnosis and treatment to quality of life, what it's like to live with NMOSD. We talk about mental health, tolerization, long-term therapies, pediatrics, and pregnancy and family planning. We also offer a medical professional network on our website. To date, we have over 210 healthcare professionals that are specialized and are in specialized medical institutions in our medical professional network. And we also have an additional Ask the Expert podcast series. So we launched that in 2012, and those have been listened to more than 34,500 times. And we do have different formats of the podcast, including research and Ask the Expert for the COVID-19 editions as well. So we currently have an AFM physician consult and support portal. This is where it's an opportunity for individuals to contact SRNA, and they are directly contacted to the professionals at UT Southwestern and Johns Hopkins. And we are expanding this to include all of the disorders, not AFM. So that'll be coming out soon. And cure. So we have established the Eclipse Fund in memory of Pauline Siegel. So our association started as the Transverse Myelitis Association and was led by Sandy Siegel and his wife, Pauline. Started in their kitchen. In 2017, tragically, we lost Pauline, and since then we have established the Eclipse Fund in memory of Pauline. And we accelerate research to advance our understanding of the causes and the natural history of these disorders, to develop new acute and restorative therapies to improve the quality of life of those affected by these disorders. And so SRNA-initiated research today has included our SRNA registry. We've done a study on experiences with vaccinations, have done a COVID-19 survey as well. And our SRNA registry is open to any individual who's diagnosed with one of the disorders or caregivers of a child diagnosed. And we also have our James T. Lubin Clinician Scientist Fellowship Award. That is a long title. So, but our objectives with this are to provide high quality, state-of-the-art, comprehensive clinical care to patients with ADEM, AFM, MOG, NMO, ON, and TM, to advance the research and understanding of these disorders through clinical research and/or basic science research, and to become an active participant, future leader in the rare neuroimmune disorders clinical community. And we actually have evidenced the benefit of this fellowship today. So Dr. Kyle Blackburn was one of SRNA's fellows. Dr. Cynthia Wang was also an SRNA fellow. So to date, we've funded 7 fellows, and we have 4 training institutions that is now being expanded to 7. So you can see the list of some of the other experts that we've been able to put out into the neuroimmunology field. And this is our latest addition. Our 2023 fellow is Dr. Chen. So I know I went through that really fast, so thank you for bearing with me. But if you have any questions about SRNA, please feel free to email us or catch me afterwards, and I'll be happy to answer.
Thank you.